Hi, I'm Dr. Emma Craythorne. I'm a consultant dermatologist and this is the After Hours Skin Clinic. Expert skin advice on those questions I'm always asked outside my clinic. And in this episode, we're going to talk about vitamin C and does it actually work? So picture this scene. I'm in a cafe with my daughter Florence, who is a very typical teenager and knows everything that there is to do with the skin and skincare, or so she thinks. And we are waiting on our juices, and she tells me that she doesn't need to put any antioxidants on her skin because she gets all of her antioxidants that benefit her skin from drinking lots of vitamin C. I think about this whenever I'm asked, can I drink enough vitamin C to have a positive effect on my skin? Well, the answer to that is quite simple. No, you can't. Vitamin C is incredibly useful for many purposes on the body, but actually trying to get that to the skin to exert this positive effect that you will often hear people talk about, you're never going to drink enough to make that happen. So listen on, and I'm going to tell you all about the science of vitamin C and how you can actually benefit your skin by using it in the best way. So what exactly is vitamin C? It's a question I get asked all the time. And vitamin C is from this group, the antioxidants. And to think of what an antioxidant is, it's something that reduces oxidative stress. So our body generates something called free radicals, and free radicals are these little molecules that are unstable. And in order to make those molecules stable, they will typically steal an electron from something else. And this is happening in our cells all of the time. And when it steals an electron from something else, it causes that thing to then be unstable, and that thing has to steal an electron from something else. And every time that happens, there is a little bit of stress or damage that occurs within the cell. And why that's important in skin aging is that it's something that contributes to our skin aging in a more accelerated way. So when we think of how we might want to stop that process, this oxidative stress process, that is where the wonderful world of antioxidants come into play. Because antioxidants act almost a little bit like a sacrificial lamb. They're really happy to give over that electron and stabilise that unstable molecule. And then you stop this onward decline of what can happen and cell damage. So when we think about using antioxidants, our most studied antioxidant is something called vitamin C. And that really is where most of the evidence lies when we're thinking about applying this to the skin. An oxidative stress response is a little bit like when we think of metal rusting, or when we think about cutting into an apple and then that apple starting to turn brown. That's a process of what happens when there is oxidation of a substance. That's a bit simplistic, but it's a little bit like that whenever we think about oxidative stress on a substance, and in this case, it's our skin. So vitamin C is probably the most studied antioxidant, and it's something that is a water-soluble antioxidant, and it can sometimes be a little bit difficult to get it into the skin. And more on that later, because if you're going to bother with using an antioxidant, I want to make sure that you're going to get the one that's going to be doing the job and being effective for all of these wonderful benefits I'm probably about to lay out to you now. So one of the things that we know that vitamin C can do is that it can increase the collagen synthesis. That's making more collagen, that bouncy substance that makes up our skin. It can increase more of that. And importantly, it can also decrease a substance that breaks down collagen. So it's a win-win, really. You make more collagen, and also you're stopping your body from breaking down the collagen that you've already got. So one of the first studies that came out looked at exactly that. It looked at it in women and examined the inner part of their forearm. So this is area that wasn't necessarily exposed to the sunshine, but just was associated with aging. And we could see this response within the skin. The next thing that it does is it reduces this oxidative stress, just as I've outlined. And that is something that's important because it's associated with accelerated aging of the skin. And by accelerated aging, I mean that mottled brown pigmentation that can occur on the skin, that yellow sallowness that can occur on the skin, and then obviously the things that we always associate, things like fine lines and wrinkle appearance. And this oxidative stress is part of the component of that. Now, why do we get oxidative stress? Well, the biggest cause really is exposure to ultraviolet radiation. Ultraviolet radiation is damaging to our skin for two reasons. It can directly damage the skin by its UVB rays, but it can indirectly damage the skin via its UVA rays, and it's that causes this oxidative stress response. Other things are things like cigarette smoking or pollution or exposure to heavy metals. All of these add additional stress to the skin. But, it happens to us every single day. Whenever we breathe, that can cause an oxidative stress response. And when we exercise too hard, when we eat bad foods, particularly sugary, very high sugary foods, all of these can add to an oxidative stress response. So obviously, some of these things we have to do because that's part of being alive. But other things like overexposure to ultraviolet radiation and pollution and smoking, some of these are lifestyle choices. And many of these can be then helped if you have antioxidants on board. The next thing that we know that vitamin C can be helpful for is that it reduces the activity of an enzyme in the skin called tyrosinase. And that enzyme is responsible for making the pigment, melanin. Now, melanin is a wonderful substance and we really want to have that in our skin because it's responsible for protecting our DNA. It sits on top of all of our skin cells and protects the DNA to stop it from being broken down by ultraviolet radiation. So we do need melanin. But for some people, and particularly this happens with age or sometimes with injury or trauma or inflammation to the skin or sometimes because of some medicines, we make melanin in a bit of a disorganised way and it can look like brown patches on the skin. You'll have seen these in people often on the back of the hands or in the face where they get brown patches with age. And that is because the melanin is being made in a slightly abnormal way. And so one of the benefits of vitamin C can have is that it reduces that enzyme that makes too much of that melanin. And therefore, from a almost cosmetic perspective, that you can then improve that appearance and reduce those brown marks within the skin. One of the other things that we know that vitamin C is really good for is in reducing the areas where somebody might have had some sunburn. So whenever you're exposed to ultraviolet radiation, you then can often turn red. And for people who have antioxidants on board their skin, and actually sometimes they might have taken a different form of an antioxidant in a tablet, then that can actually reduce this redness in the skin. And increasingly, we are now knowing that with using some of our energy-based devices and lasers, that if we use vitamin C topically on the skin, then it can also speed up the recovery from that. I think one of the greatest things about how we can protect our skin from aging is undoubtedly wearing an SPF, and that's my number one recommendation to everyone. But topical antioxidants, particularly vitamin C, whenever it's formulated correctly, then that is giving that additional benefit. And when I've trawled through the literature, I've certainly not found a paper that has said that topical vitamin C is not helpful in any of these kind of roles I've outlined. It's time for a brief ad break, but stick with me. I've got a lot more SPF Gold Dust to share with you right after this. It then comes on to, well, which vitamin C should you buy or which group of antioxidants should you buy? Some of them are really expensive and some of them are really cheap. And sometimes you'll see a bottle and it'll just say vitamin C on it. And not all of these vitamin Cs are created equally. When we look long and hard at the actual clinical studies that are available, it's fair to say that if you're wanting to go for something that has a vitamin C in it, that vitamin C needs to be in a particular form, and it's L-Ascorbic acid. So if the ingredient doesn't say L-Ascorbic acid, then it doesn't have the same clinical evidence to back it up. I'm not saying those other ones don't work. I'm just saying that there is no evidence or very few clinical studies to support them. So my advice would be, if you're going to bother with this, that you go with something that says L-ascorbic acid. The next thing is it has to be in a particular dose, because you don't want it too light so it's not going to have any effect, and you don't want it too strong so that you run into the way of side effects. And the sweet spot for vitamin C for these benefits I outlined is really between 10 and 20%. And I normally kind of tell my patients to stick around the 10 to 15% mark, because that is where you see this best curve of risk and benefit whenever we're treating patients in clinic and we see the outcomes that they have. So number one, it must be L-Ascorbic acid. Number two, it should be between 10 and 15% strength. And then the other thing is how it is delivered. And it has to be delivered in a way that L-ascorbic acid is actually going to be active and get into the skin. And it has to really be delivered in a solution that is pretty acidic. So it must be in a serum, and the solution is sitting around about the pH 2.5. So this is really quite acidic. And often I'll see, formulas that are on the shelf and they're in these lovely moisturising cream forms, and they're never going to be able to deliver that vitamin C in that strong acidic pH that it really, to be honest, needs to be delivered in to match up to these clinical studies. So they're the parameters that you're typically looking for if you're wanting to invest in a topical solution of vitamin C. Whenever we think about how we might want to use that topical solution of vitamin C, it's only to be used in the morning. So you would wash your face and then you would apply the vitamin C. Usually around about 4 drops will cover the face. And it's integrated within the skin in about 8 seconds. So even if you decide then to go for a swim or a shower or whatever straight afterwards, it's already integrated and it's doing its job in this role of protection. And you do not need to top it up again throughout the day. In fact, there was a study showing that if you top it up, you kind of disturb the circadian rhythm and actually can cause detrimental effects if you're putting it on later in the day. So the vitamin C just goes on in the morning, and then that goes on underneath your moisturiser or your SPF. Not or your SPF, definitely your SPF, but maybe your moisturiser. So the order should be the cleanser, the antioxidant, vitamin C, and then a moisturiser if you wear one, and your sun protection is key. Vitamin C is broken down by sunlight, so packaging that's not UV protected, again, is not going to be very effective in terms of being able to deliver vitamin C to your skin. So that's another very quick thing to immediately rule out if you're considering a product. And then we look at the expiry dates. Vitamin C in certain forms does not last very long, and the activity of it immediately starts to decline as soon as it's been made. So something with a very long expiry date or something that's been opened and hasn't been used, in all honesty, probably a lot of that vitamin C and the activity and the benefit you're expecting from it will have gone. And then there are some people who might find using vitamin C a little bit irritating to the skin. And it's not so much the vitamin C itself, it's more to do with the fact that it's in this very low pH, and that can be a bit irritating for some people's skin. So are vitamin C's effective for the skin? Well, for the role of protecting your skin and adding that additional bit of protection, I would say yes. This is something, if you can, you should introduce it into your skincare routine in the morning. The products I recommend all come from the SkinCeuticals range. They meet these parameters I've outlined exactly. And also, I like them because there's a lot of clinical studies to back up the evidence of what they're saying. And by clinical studies, I mean these products are tested on people, real people, and they have outcomes that show that this product is effective. And it's effective for often things like skin glow, skin aging, pigmentation, and in some cases, the spots that go along with people having acne. The products are, number one, I would say the SkinCeuticals CE Ferulic. This is 15% vitamin C, and this I'd probably recommend for people who have a slightly drier skin type because it's in this oily vitamin E base. The second one I'd recommend would be Silymarin CF, again from SkinCeuticals, and this is in a watery base and is really suitable for somebody who has probably a more oilier skin type prone to acne. And the clinical studies on this really show that it reduces blackhead formation, it reduces those active inflammatory spots. And then number 3, again from SkinCeuticals, would be the Floritin CF. This has got a lower strength of vitamin C in it at 10%. It's still within those effective parameters I talked about. And this can be very effective as an introduction vitamin C, but also because of the Floritin, it's effective for those people even more so with hyperpigmentation. And I love this as part of any anti-hyperpigmentation routine that I might be suggesting for someone. So for the best results of it, you're using this in the morning after you've washed your face, and you can use this every single day. Okay, that's it from me this time. I hope that helps. And remember, not all vitamin C's are created equally. It has been shown to have great benefits in the skin in terms of reducing pigmentation, reducing oxidative stress, and helping the skin look better for longer because it's supporting the skin. And also there's some evidence to show that you get quicker recovery after laser treatments, as well as this stimulation of collagen and, importantly, stopping your body breaking down that valuable collagen that you have. If you haven't already, please do subscribe. As we're a new podcast, it really helps us to reach more listeners, and it means you won't miss another episode. Until next time, my lovely listener, take care of yourself and your skin, and I'll see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.